afternoon, everyone. My name is Julie Mesa. I'm a nursing student of Universidad Nacional de Colombia. I'm going to talk about how you see cardiopulmonary resuscitation, Cpr in adults. Well, why is this important? This is the principal cause of death worldwide, and almost 50% of deaths ranging from 30 to 60% in each country. And what is the situation in Colombia? If you see in this image, the ischemic heart diseases is nearly 70% in this in this image, and the origin is cardiovascular, and the complications are lethal arrhythmias. In the next image, you can see that for the last reason, the mortality is increasing in Colombia. Why is this important for you, for me, about CPR? 70% of all cardiorespiratory arrests happen out of the hospital, and all of the above I say, it is vital to train the community in recognizing cardiorespiratory arrests. Immediately, CPR can double or triple chances of survival after cardiac arrest, okay? The American Heart Association has the sign of survival, and the CPR is a critical step. Why is this important step? This is the second one, but this is a chain of survival, and the first one is activation of the emergency. Second one, immediately high quality CPR, how I say. Third, rapid defibrillation. Fourth, basic and advanced emergency medical services. And last one, advanced life support and post-arrest care, okay? If you ask you how to recognize if the person is having a cardiac arrest. First, ensure and scene safety. You should verify the environment as a providers, because it's important the person by you too. Second one, check for response. Tap shoulders. And are you alright? Take a pulse. How do you do this? Index and middle finger in the carotid artery for 10 seconds and simultaneously check if the person is breathing, okay? Third, check for no breathing or only gasping. Fourth, activate emergency response calling 123 if you are in Bogota, or 3165 000 extension 88888 if you are at Universidad Nacional de Colombia in Bogota. Fifth, if someone responds, ensure that the phone is at the side of the victim. It's important that you say the location of the incident, the event of the incident, condition of the victims, and the type of height provided. What is the technique for CPR? First one, compression. Second one, airway. Third one, breathing. Compression. It's important that you take the person in a firm place. Second one, bare the chest and prepare your hands, okay? How do you do this? The wrist cord should place the head of one hand of the center of the sternum. How do you see in this image, okay? At the level of the intermammary line of the victim, and the head of the other hand, how do you see in this image? Top of the first one, so that the hands are overlapped and parallel, okay? Maybe 90 grades for you, like a provider, okay? And start chest compressions, obviously. I have facts for you, important facts for you. First one, chest compression at a rate of 100 minutes to 120, because if there are less than 100 per minute is not enough oxygen will reach the brain, okay? It's the same like the blood return to the heart is reduced and the heart obstacle filled with as much blood, obviously. Did at least 2 or 5 centimeters, the chest compression and chest recolarization times have to be approximately equal. I have the last one. When 2 or more risk holders are available, it is reasonable to switch chest compressors approximately every 2 minutes. Okay. The next step, using a head tilt chin lift maneuver with this finger, index, and middle again. Breathing. Use a barrier in the possible. Put lips over the victim's mouth. Take a regular breath, not a deep. Deliver a rescue breath over 1 second and repeat. Give sufficient air to produce visible chest rise, but not excessive, okay? Because this increase intrathoracic pressure reduce venous return to the heart and reduce cardiac output and survivors. So it can also cause gastric inflation and result in complications such as regurgitation and aspiration if you do this with the liquid of the stomach in the lungs, okay? How do I say? Produce visible chest rise that you can see. Finally, you have to remember this: 30 compressions and 2 risco breaths in 24 seconds, and this for 5 moments is 120 seconds. Is the same to 2 minutes, and you have to check the pulse if the circulation has returned, okay? And that's all. I want to say that thank you for your attention, and remember, saving a life is in your hands. With love, your nursing friend, Julie.